Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. On this video, we want to share a little knowledge with you about stress and paranoia. Previously, you must have often heard about stress and paranoia, right? Or maybe you often hear someone say like, I'm under a lot of stress, or maybe I'm stressed. But do you really understand the meaning of it? Such as what are the symptoms, what causes it, and how to treat it. Let's find the answer by watching this video. Okay, before we explain it more detail, I will introduce our member or the member of Group B. There are the Kaputri Ayuni, Salma Aulia Asia, Safira Widyasari, Sofa Anina, Sofia Firdausia, and last is Zakira Abdulazari. In today's presentation, we will talk about several mental disorders. We all know there are many kinds of mental disorders, so today we will focus on stress and paranoia. We're going to talk about their differences and similarities, including the causes, symptoms, and treatment. We like this topic because we think these two materials are very relevant and often discussed in the material we study as psychology students. So for the next topic, will be explained by Sophia. For Sophia, time is yours.
Okay, thank you, Widya. Now, before we are going any further with these disorders, by talking about the symptoms, causes, and treatments, let's find out what stress and paranoia is. We must have often heard about these disorders, especially stress. We even might have experienced stress before. But do you know what stress is? Stress is the feeling of being overwhelmed or unable to cope with mental or emotional pressure. Severe stress disorder can lead to other serious mental problems. Paranoia is the one. On the other hand, paranoia itself is thinking and feeling like you are being threatened in some way, even if there is no evidence or very little evidence that you are. Paranoid thoughts can also be described as delusions. There are lots of different kinds of threats you might be scared and worried about. And now we are going to the main point of our presentation today, the differences and similarities between stress and paranoia. This main point will be divided into three sub-main points. There are symptoms, causes, and treatments. And the first one about symptoms, stress and paranoia will be explained by my friend Rivka. Rivka, please, time is yours.
Okay, thank you, Sophia. So, when we talk about the symptoms between stress and paranoia, there are four approaches for the symptoms. First, about the cognitive symptoms. When you are stressed, you may be unable to concentrate and see only negative. On the other hand, someone with paranoia may consider the world to be a place of concentrate and believe in unfounded conspiracy theories. Next, about emotional symptoms. People experiencing stress might have some symptoms, such as moodiness, irritability, or anger and feeling overwhelmed. While people with paranoia have these symptoms, easily offended and overly suspicious. The third is physical symptoms. When you are stressed, you may have nausea, dizziness, chest pain, and rapid heart rate. On the other hand, someone with paranoia may have too little sleep. And the fourth approach is behavioral. People experiencing stress might have some symptoms, such as withdrawing from others, procrastinating, or neglecting responsibilities. While people with paranoia have these symptoms, not be able to confide in anyone, and be hostile, aggressive, and argumentative. The next topic will be explained by my friend Salma. Salma, time is yours.
Okay, Rivka, thank you. Besides the differences that had been mentioned before, there are also some similarities of symptoms of stress and paranoia that can be found. Both stress and paranoia will find it hard to socialize with others. It can be shown from the difficulties in finding relationships with someone, and even withdrawing from others. Furthermore, both stress and paranoia can increase anxiety, and apparently paranoia is more strongly related with anxiety. Okay, the next material will be explained with Zakira, and Zakira, time is yours.
Okay, thank you, Salma.
Let's move to the next part. I'm going to tell you about what causes stress and paranoia. First, I'm going to talk about stress. So, what kind of situations can cause stress? Stress can be caused by different common life events, many of which are difficult to avoid. For example, it can be about work or school, such as losing your job, being long-term unemployment, retiring, even starting a new job, or maybe if you are a student with exams and deadlines, it can also cause stress. Some financial problems and major life changes can also cause stress. Of course, not all stress is caused by external factors. Stress can also be internal or self-generated. When you worry excessively about something that may or may not happen, or have irrational, pessimistic, and unrealistic thoughts about life, it can also stress you out. Now, let's talk about paranoia. So why do people experience paranoia? No one knows exactly what causes paranoia. There are lots of theories and different people will have different explanations for their own experiences. It's likely to be a combination of things. These are some examples of things that may contribute to paranoid thoughts. The first one is lack of sleep. Lack of sleep can trigger feelings of insecurity and even unsettling feelings and hallucinations. The second is life experiences. You are more likely to experience paranoid thoughts when you are in vulnerable, isolated, or stressful situations that could lead you to feeling negative about yourself. The next factor is the external environment. Some research has suggested that paranoid thoughts are more common if you live in urban environment or community where you feel isolated from people around you rather than connected to them. Genetics, physical illness, and last but not least, brain chemistry also play a role in causing paranoia. The next material about the similarities of what causes stress and paranoia will be explained by my friend Sofa. Please, time's yours.
Okay, thank you, Zakira. I will explain about similarities causes of stress and paranoia. Moving on the similarities of causes of stress and paranoia, dopamine attempts to explain the pathogenic mechanism and origins of the disorder respectively. Paranoia resulting from hallucination would cause further stress and eventually revert dopamine dysregulation would increase psychotic belief. On the other hand, external problems such as traumatic life event can also affect your self-esteem and the way you think and feel as an adult throughout life. Okay, the next material would be explained by my friend Sophia. Time is yours.
Okay, thank you, Sofa. We are moving on how do we treat these mental disorders. First, we are going to talk about the treatments for stress. There's brief interpersonal psychotherapy or IPTP. The therapist on this method collects basic information about the family of origin but doesn't dwell on these relationships unless they clearly relate to the current depressive episode. Similarly, the therapist relies on patients to identify the most important people in their lives, focusing on these relationships in the time available. The second one is mindfulness-based approaches. Mindfulness-based stress reduction or MBSR therapy is a meditation therapy. The results of these researches indicate that MBSR improves the condition of patients suffering from chronic illnesses and helps them cope with a wide variety of clinical problems. Now we are moving on to the treatments of paranoia. There's a coping skill method. Apparently, paranoia has a strong correlation with suicidal behavior among people. From what we have learned before, traumatic life events is one of factors that can cause paranoia. So by treating these traumatic life events by coping skill method can reduce this suicidal behavior of people that had been diagnosed paranoia. And the next one, there's anti-anxiety drugs or antipsychotic drugs. Based on current data, cannabinoid therapies containing primarily CBD or cannabidiol may provide a more suitable treatment for people with pre-existing anxiety or as a potential adjunctive role in managing anxiety or stress-related disorders. The next topic about the similarities of treatment for stress and paranoia will be explained by my friend Sofa. Please, Sofa, time is yours.
Okay, thank you, Sophia. I will explain about similarities treatment of stress and paranoia. Both stress and paranoia can be treated by cognitive behavioral therapy or CBT. From a journal we had read mentioned that CBT is effective in treating childhood anxiety disorders. Okay, the next will be explained by my friend Zakira. Time is yours.
Okay, thank you, Sofa. To summarize, we already explained about the definition of stress and paranoia. While stress is the feeling of being overwhelmed or unable to cope with mental or emotional pressure, paranoia itself is thinking and feeling like you are being threatened in some way, even if there's no evidence or very little evidence that you are. We also explain about the similarities and the differences between paranoia and stress for their cognitive, physical, emotional, and behavioral symptoms, internal and external causes, and treatments. Okay, thank you. I will pass over to my friend Widya. Please, Widya, time is yours.
Okay, thank you, Zakira. So as you can see, this is next slide, please. Okay, as you can see, this is the preferences we have used for this presentation. And I think you already understand more about stress and paranoia, right? We hope that the information we have shared can be useful in your life. Finally, as message and reminder for all of us, Ashley Hetherington once made a quote that says, "In stressful times, it's okay to not be perfect. It's okay to cut yourself some slack. Because right now, you might not be your best self, but you are growing and you are trying your best. And that is good enough." Okay, that's our presentation video today. Hopefully it's useful for you. Thank you for watching this video and see you!